At the entrance to Paso Robles, a city in northern San Luis Obispo County, there's a 200-unit apartment complex that has mold, bed bugs, cockroaches, broken windows. If this has been allowed to exist, what else is out there in SLO County in terms of substandard rentals? And why are people allowed to live like this?
Gracias por continuar en sintonía, amigos televidentes. El día de hoy me acompañan dos reporteras del diario Tribune de San Luis Obispo.
I became interested in this topic after interviewing tenants living at Grandview Apartments in Paso Robles. Substandard rental housing in my county is kind of a hidden issue. Rental housing is super scarce, it's super expensive, and people who have problems with their housing typically don't go to the level of reporting it to a city or a county because they don't want to face landlord retaliation. There's not a lot of data in San Luis Obispo County showing the scope of that problem. To fix this, me, my coworker Cassandra Garibay, and my engagement editor Danielle Fox partnered with the Promotores Collaborative of San Luis Obispo County, which is a Latinx health advocacy organization.
Este proyecto estaba junto con los Promotores Collaborative del Condado de San Luis Obispo y fue durante 9 meses.
We went door to door surveying people about their rental housing conditions. We really wanted to know what it was like and what renters were doing when landlords weren't responding quickly.
Typically, they may not know their rights, they may not know what they can do to improve their living conditions. So we created a renter's rights guide that we distributed to renters at food banks, and then also a photo file version of the guide that we texted to people. And through those efforts, we were able to reach about 200 tenants, hear about what conditions they're experiencing.
Obviously, the pandemic changed a lot, and it changed a lot of how we were able to get in touch with people. We really were fortunate to be able to talk to people before and also continue to build that trust after. The Center for Health Journalism has definitely transitioned my way of looking at how I report, from reporting on communities to reporting for communities.
This project has really changed the way I think about journalism, how important it is to reach out to communities who may have been not served well by our newspaper, communities of color, communities that potentially don't speak English, and how important it is to really, make the effort and go out into the community and connect with them, understand their needs, and how we can best serve them.